Hello, this is Public Health Impact, and I'm Cham Dallas.
And I'm Phaedra Corso, and today we'll be talking about influenza, the flu.
You know, Phaedra, in the past, at least in this country, I think most people think the flu's not really been that big a deal.
But remember, last year, Cham, was completely different. We were approaching a pandemic. There was lots of talk about when you are experiencing the signs and symptoms of the flu, you should stay indoors, avoid public transportation. It was very different.
Yeah, it really was. And so I think that's where we kind of are now in America, is that we're going to have good years like we had in the past, and we also are going to have bad years, and it looks like it's going to be going back and forth. Good year, bad year, good year.
The million-dollar question, Cham, have you had your flu shot yet? We are in flu season, as you know.
Yeah, well, I have had the flu shot in the past, but to be honest, I haven't had my flu shot yet.
Well, to be honest with you, I haven't had my flu shot either, Cham, but in our family, we're very good about making sure that our children get their flu shot every year, and so I can tell you they have gotten theirs.
That's a good idea, to have the kids get the shot every year. But maybe the people watching this episode now, they're going to learn a lot about the flu, and maybe they can help make up their mind. Maybe we'll make up our minds too.
I hope so. Today, Cham will be talking with some experts in flu and influenza from the Department of Epidemiology and Biostats here in the College of Public Health at the University of Georgia. So we'll be learning about what is flu, what's the historical relevance of flu in this country and elsewhere, and how we can prevent it.
Today we're going to learn about the flu, influenza, from Dr. Chris Whalen. Dr. Whalen is a medical doctor, a physician, and a professor in epidemiology here at the University of Georgia College of Public Health. And he's also been active in research and treatment for infectious diseases all over the world, especially in Africa. Dr. Whalen, we've heard a lot about the flu in the last few years. Can you tell us what exactly is influenza? What is the flu?
Well, flu means different things to different people. To some, flu means a mild respiratory illness that lasts a few days and then goes away. Some people refer to the stomach flu. But in public health, when we talk about flu, we're talking about influenza caused by a very specific virus by the same name.
Well, we learned about a new type of influenza or flu last year, but is flu really a new disease?
No, flu is not a new disease. It's been with humans for centuries. Prior to the 20th century, we can reconstruct large epidemics based on historical records. But the most severe epidemic that we've noticed or experienced was in 1918-1919. During that epidemic, 50 million people died throughout the world. About 2 million people died in the United States. The epidemic began here in the U.S. actually, and then as troops moved to Europe during World War I, they spread the influenza throughout Europe. And then from there it spread to Africa and Asia.
Yeah, I remember from historical accounts that actually more people died from the flu here in America than our troops that died in World War I.
Yes, that's true. Since then, we've had epidemics of influenza that have come and gone, usually during the winter time, not very severe. There have been several other large pandemics, severe episodes of influenza in 1957 and 1967 and 77. But last year was another one of those bad years when we had a new pandemic or a new strain of influenza cause a pandemic.
So we really do have good years and bad years. I guess we have to conclude then that the flu is really a worldwide problem. It's not just here in the U.S. It affects a lot of other countries.
Yes, flu is a global disease. When it happens locally, we tend to call it an epidemic. When it happens in multiple continents, we call it a pandemic. But influenza is occurring year-round, just in different parts of the world. During our winter, we experience the epidemics. During our summer, it doesn't go away. It's occurring in the Southern Hemisphere.
In order to delve a little deeper into the source of where the influenza or the flu comes from, we're going to talk to Dr. Steve Valeka, a veterinarian scientist and on the faculty here in the Department of Epidemiology here at the College of Public Health. And the first thing I have to ask you, Dr. Valeka, is why is a veterinarian here involved in this process?
That's a good question, Cham, and a common question. Influenza, the virus, has its origins in animals, in ducks, other waterfowl, and pigs as well, and then occasionally jumps over and infects humans. So in order to understand the flu virus, we really need to understand its animal origins.
Well, why do we continually hear about this thing? It seems like it never goes away, it comes back. Why does this occur like this?
We continually hear about it because it's continually a problem. Influenza virus transmits throughout the northern hemisphere during our winter and then into the southern hemisphere in our summer. So the virus is always out there in nature. The other thing is that the virus changes. It actually is a slightly different virus from year to year. So it's not so much why doesn't the flu go away, but there's also new flus constantly entering the circulation.
Well, that sounds strangely or closely affiliated with mutations, okay? And in the mind's eye of the public, we are just flooded with these movies about viruses mutating, and of course it usually winds up with violent behavior in the movies. But what are we really dealing with mutations here in the real world here with the flu?
Sure. Luckily for us, influenza doesn't cause people to become flesh-eating zombies, so that's a big relief. But it does undergo mutations, and this is sort of what you would think of when you hear about mutations in a movie, is that the genetic material of the virus is changing, and it's a mutant form that comes out. What happens with influenza is it changes by two different mechanisms. One is a really slow change, where small mutations happen in the genetic material of the virus and cause it to be a little bit different. These gradual changes in the virus that occur over time, that's a process known as antigenic drift. There's another mechanism that influenza viruses can change, and this is a more serious mechanism, and it's called antigenic shift. When antigenic shift occurs, it's because two different influenza viruses happen to be infecting the same duck, the same pig, the same human. These two viruses get together and they say, hey, let's trade our genetic material with each other. That might be fun. So they swap genes back and forth, and what comes out, the new mutant, is completely different from either of the progenitors to that virus.
Well, I hear people refer to the flu as H1N1. What does that mean? Why are they losing these letters and numbers to describe this?
This is mostly an attempt to confuse the public. But in addition to that, there's a scientific basis, and that's that the H and the N stand for different proteins that stick out of the surface of the flu virus. And one of these, the H, is called hemagglutinin. The N is called neuraminidase. We'll quiz you at the end on spelling those terms. And basically, these proteins are used to characterize the different flu viruses, the different types of flu viruses.
We have to talk about bird flu. We have a veterinarian scientist here. What in the world is going on with this bird flu thing that appears and then it disappears and it seems like it comes back?
Sure.
What is the bird flu?
Bird flu, also known as H5N1 influenza to use the terminology, is a virus of birds, generally of chickens. Chickens get sick with it, and they can transmit it directly to people. H5N1 flu is very severe. It kills more than 50% of the people that get infected with it, so it's highly pathogenic. Luckily, this strain of the flu does not transmit very easily between people to people, if at all.
Okay, well, that's a good explanation, Steve. Thank you. I think we're going to move on now, and in this next segment, we'll be talking about the symptoms, treatment, and prevention when we actually do get the flu in people.